Welcome back to Uncovered, everyone. Today we are talking all about injuries with the pole physio, Simone. So welcome onto our podcast.
Thank you so much for having me.
We're so excited to have you here. Sorry, I cut you off.
Yeah, we're still learning. So this is our very second guest that we've had via what's it called, Riverside, which is like Zoom, pretty much. So we're still learning how to give each other some time to talk as well, so that we're not talking over each other like me and Steph always talk over each other. So welcome to our podcast. We just want to start by asking you, who is the pole physio?
I guess it's me to start with. So I'm Simone, I'm the pole physio. I'm a physiotherapist based in Australia who created the pole physio, I guess from a bit of a whim, but I guess there's probably a bit more backstory to it. It wasn't just out of nowhere. There was 5 years of pole behind it, where I'd turn up to studio and listen to the instructor ask every session, who's injured, like what do I need to know, how can I help you guys today? And every session there would be not just one or two injuries, but there would be like 6 or 7. I remember one particular session where there was a class of 15 people and 14 people were injured. And I, for quite some time, was trying to separate my physio to pole. Not from not because I didn't want to be involved with pole. It was just more that was my happy place. And I really needed pole to be a me place whilst I was sorting things out in my life. And it just got to a point that I went, nah, this is now beyond unacceptable. It's reached ridiculous levels, and I just needed to basically do something to help with that. And one of the girls in our student groups put something up on our Facebook page and started speaking about cortisone injections with this and that, and I just went, whoa, like why is this happening? Why are you rushing off for a cortisone injection? And like what sort of rehab has been done? And you know, just the diagnoses that were being thrown out there by healthcare professionals that just didn't seem to match up with injuries. And I went, nah, this is, enough's enough. I need to sort of do something about it. So that's how the pole physio started, and since then I now have a pole physio team, so it's no longer just me. I'm no longer just the pole physio. We've got a whole range of pole physios.
We're growing.
So I've got another pole physio in Melbourne.
Exciting.
Yeah, it's so exciting. Another pole physio in Melbourne, Julia, who goes to the same studio as myself. I've got a couple of other pole physios around Australia, and then even got a pole physio in Canada. So we're gone international, which is awesome.
Holy shit. And like the pole physio only started last year.
So,
that growth is like amazing.
It's been a roller coaster.
I do have and a good roller coaster for the pole world, 100%. I do have a question off the back of your story there. I'm just going to dive right in with so we promote this in our studio too. Instructors always ask, are there any injuries? But is that necessarily the right thing for us to be doing as instructors? Because then, and we say this to our students, we're not physios. We don't really understand it to that level, but is this the right way to approach these things? Yeah.
Yes and no. That's a really good question. I've never been asked that before. I really like that question. No, it's great. Yes, because it's really good for you to, as an instructor, know and keep the student accountable for any injuries that they have. Injuries are obviously rife in pole, so it's really important to know and communicate and be aware of what your students are able to do, or potentially any restrictions or limitations for that session. It's also a really nice chance to, as the instructor of the class, the student looks up to you. You're, a leader in many ways. So it's a really important time for you as the instructor to touch base with them and go, how is that rehab going with your physio? Or, have you been seeing someone about this? So it's really nice from that point of view. When it's not okay is when you take the matter into your own hands as an instructor and start providing medical advice based on your own previous experiences or your knowledge without a medical degree behind it. So that's when it crosses the boundaries, or when you start dishing things out left, right and centre, go, oh, try this, it works for me, or try this, work for me. Leave that to us. That's what the healthcare professionals are for. If we believe, patient X would benefit from this, then we'll get them on it, don't worry. Trying to suggest the latest pharmaceutical invention, or go, oh, this injection worked for me, so you should just go do that. that's influencing them, and it really it's directly influencing them, and they will look up to you and take that information on board. So I would say from that point of view, no, absolutely don't stay away from that. That's also breaching your scope of practice, and you could potentially open yourself up for a lawsuit. But from a general point of view, absolutely, yeah, you just got to be careful with those things. But no, from a general point of view, I think it's great. It's a brilliant way to build rapport and also just know what you are going to do with the person for the session. So if you had planned some, I don't know, outside leg hangs, and they're telling you how they really hurt their hamstring the previous day, you might go, okay, maybe we will just work on some upper body strengthening and some chair spin variations, for example, instead. So it kind of helps you plan your session as well and modify.
So I have a question, actually. It happens all the time in classes for me, especially when I ask, hey, does anyone have any injuries, or is there anything feeling funny about their body today? And people might go, oh, it's my wrist or this, or, sometimes they're like, oh, my wrist hurts. What do I do? And I'm like, well, I don't know what to do. You got to go to a physio. But then people are very resistant. They'll come back week and be like, oh, it's okay. It's still feeling funny. I'm like, have you gone and got medical assistance yet? Oh, no, I haven't. So from that point, it's then what can I do as an instructor apart from keeping encouraging them to go see someone to help them not to injure themselves worse, or from there I sort of say, okay, well, depending on your level of pain, I don't want you to be pushing it and doing it. It's up to you to feel where your level is, but I can't force you to do something if you're not going to go seek some, medical help.
Yeah, I think that's really important to know, that you physically can't force anyone to seek help, but there is this, particularly in the pole industry more than any other industry I've come across, there is this sort of injury gaslighting that people do to themselves, where they're like, she'll be right, and they just go, it's not as important, it's not a major injury, and they just play down their pain or their injuries or their concerns, and they will just push through it thinking it's not much at all. And the Artist Athlete did a brilliant post on this recently on social media that I just absolutely adore. And I would encourage everyone to go check it out if you haven't seen any of her posts before. But I think it's important to, as much as possible, create an environment where any injury, regardless of the severity of the injury, is treated seriously. Even if you have wrist pain that's a 1 or a 2 out of 10, it doesn't mean you push through it. And I don't mean you can't exercise and can't continue to pole, but you just don't push through it in terms of leave it alone. You need to seek a guidance and help as to how to fix that, because I can guarantee you that 1 or 2 out of 10 pain won't go away, particularly if it occurs every time you pole. So if you go, oh, it settles down within a day after I pole, fine, but in 6 months' time, that's going to be a 3 or a 4 out of 10. And then in a year's time, that's going to be chronic, where it's not settling down after pole. So it's really important to try and get any issues addressed earlier. And I usually find injuries like that, there's usually a secondary cause for it. So it may be that the wrist is hurting because there's actually lack of shoulder stability or strength. And so as a result, it's really important to address the issues. And in the meantime, you're fixing multiple causes, and you're also potentially preventing another injury occurring. So by getting that wrist seen to earlier in the piece, you're helping future self out. You just might not realize it. And it's so funny because I know we'll talk at some point today about injury prevention. It's not sexy. It's not what everyone wants to do. And you won't know if you've prevented an injury. No. And that's the point of it. You shouldn't know that you've prevented an injury because you shouldn't get injured. But the point is, if you can strengthen early on.
That's so true. And
you go.
Yeah, I think that as well, and this was one of our listener questions, but really, really, a question that gets asked so often is how do people know the difference between muscle soreness and injury? Most people put it down to, I think I'm just a little bit sore, I might, maybe just a bit of overuse. I'm just going to wait and see. Is there an time where people should just wait and see if it's muscle soreness, and then assess, how do people do that own self-assessment before they go to a physio? Because yes, it can be expensive and people don't necessarily have that income to be able to do it every single time they're a little bit sore.
Yeah, and that's a really good point. I think the more you know your body, the more you'll know whether it's soreness versus muscular-based soreness. And I think, so we're talking specifically delayed onset muscle soreness, or DOMS is the short version for that, versus pain. I will always go back and ask myself, if I'm feeling DOMS in one of my muscles, did I use that muscle? It comes back to that, quite simply. Like a couple weeks ago, I was working on an overhead press. My triceps the next 3 days were agony, but I was also suddenly pushing 30 kilos overhead, which that was an absolute max for me in terms of doing landmine presses. I was very sore. Was that expected? Absolutely. Did I start to see improvements within those 3 days? Absolutely. Was that an ongoing issue that's happened to me many times before? No. And so if it settles down within a very short period of time, so that 48, 72 hours, and it doesn't then pop up again later on, then completely fine. If I was to continue pushing new, heavier weight, I would expect soreness every time. But if I was to stay at that weight or drop that weight down a little bit, then I wouldn't expect the same level of soreness. So I think you just need to ask yourself, am I using the muscles that are then turning into or becoming sore? Or is it that I'm starting to get soreness in different areas that aren't being used? So that's probably the first thing. And then 2, is it a reasonable response in terms of pain? Like, is my pain a 10 out of 10? That's not okay. Like, even if it's DOMS, it shouldn't be like that. DOMS will quite often be like a restriction of movement. So the muscle will just want to contract. So for example, with the tricep, I didn't want to bend. I didn't want to even eat with my right hand the day after, because bending it was just not a happy time for the tricep. But if I, for example, was able to do that and it was still really painful, I'd go, oh, there might be something else wonderful and weird going on here that I need to get looked into. But I would generally say if it's lasting for more than 48 to 72 hours, that's a warning sign. And if the pain is more than like a 4 or 5 out of 10 and it's not improving over time, then that's something to get looked at. So if it is an 8 out of 10 the first day, but it stays an 8 out of 10 and it continues to say that for a couple of days, that's something that needs to get looked at. I know it's very vague sometimes, the guidelines.
I think the injury... Yeah, I was going to say, because I think the injury gaslighting is an interesting one, because I fractured my rib cartilage a few years ago. Apparently quite painful thing to do. Did not hurt at all. Like, it took me 3 weeks before it started hurting in pole. But what I did have, and I probably should have listened to from a body perspective, is this lump formed on my chest. And I'm like, oh, that's weird. Like, oh, I was just doing some yoga today. Like, it came sort of out of nowhere, but that pain it took about 3 weeks for that pain to get very, very bad. And then it took about 3 or 4 months to diagnose after that. But I think the thing I did, and I've never heard injury gaslighting as a sentence together, but the thing I did was like, it's fine. Like, it's okay. Like, it'll just go away, right? Like, and I was very body aware. Like, I knew exactly when it happened. I just had no pain associated with it. And yeah, it wasn't until pain came later on down the track. So I think it's, and I don't know, it's not even just pain. It's like changes in your body that maybe haven't been there before. So I guess that's a whole body awareness situation.
Yeah, I think that's a really good point. Yeah. It's multifaceted pain. Pain isn't straightforward. It's really complex. Like, I could spend hours talking about how complex pain is, so I won't do that to everyone. But yeah, it's about it's about looking for any signs of injury. What's your movement like? Does it feel normal? Does it look normal? Is it swollen? Is it chronically swollen versus mildly swollen? Like, things like that you can certainly look for. But understanding, first of all, pain is complicated, and because you have pain doesn't actually mean that you're injured. That's the first thing. But because you have pain, that means there's something to figure out why you have pain. So yeah, and we did do a good blog on this recently, hurt versus harm, which I encourage people to check out if you are experiencing pain, in terms of understanding the difference between are you hurt versus are you actually, harmed in terms of injury. So yeah, that's a good one.
Yeah, that was a really good one. I read that one, and I think you said in it at some point about like pain is so relative, because you could be doing like a sphere drop and be like, yeah, this is great. And you could like stub your toe and be like, this is the most painful thing ever. So it's like, it's so relative to how you interpret what you're doing. And same with like if people are getting like needles or blood taken, if you have a fear of that, it's going to feel so much more painful than, yeah, if you're doing something. I know if I'm in public and I hurt myself or whatever, I'll just like, I won't say anything, so it won't feel as painful. But if I'm at home or if I'm in a bad mood, like I could do the littlest thing and boom, like I'm just like, that was the most painful thing ever. So it definitely is very relative. But I also had a question. So in terms of like going and seeing a physio, I know one of the biggest concerns I hear is, they're just going to tell me to stop. Like I don't want to stop pole, and they're just going to tell me to stop doing it. And whether they've had an experience where a physio or a GP, they've gone to a GP and told them, it hurts, so just stop. What is your sort of like advice back to them in terms of them putting that off, not wanting to go seek help?
Yeah. I'd say, first of all, to the healthcare professionals, it's 2021, like get your shit together. So that's probably the first thing, is stop telling patients to stop doing it. Like, just stop it. There's no other way for me to say it. But like, it is. It's 2021. Gone are the days that we treat people with, putting them in a collar or a cuff, or like, bracing them for everything unnecessarily. Like, there are just so many examples out there in the medical world as to why we don't need to baby our patients anymore. Okay, so that's the first thing, I think, to healthcare professionals. To patients, if your healthcare professional is telling you that, it's time to find another healthcare professional. I can't change the world. Despite me trying, I can't do it. I can't reach every healthcare professional out there from a pole perspective, or like, even if they are non-pole based, or circus or aerial based physios and GPs. Regardless, if your healthcare care professional is telling you that, it's time to find another one. And there's a difference between not liking what they say versus them telling you to stop everything, because there may be cases where a healthcare professional does legitimately need to tell you to stop doing something because it's making things worse. And that's okay if it's true, but they should always be able to find something else that you can do on your apparatus that you can still train. If you have a wrist injury or a shoulder injury, there are other things that you can be working on the pole. Okay, you could be dancing, you could still be doing other forms of tricks and so forth. You can be working on your splits, you can be working on, movement, there's so many things you can be working on, but there may have to be modifications to certain positions and certain tricks. A great example is a brilliant patient I have up in Queensland, who dislocated their shoulder last year, and within a couple of weeks was back on the pole, and didn't actually technically stop poling, was able to do things immediately after the injury. I remember they got in contact with me within a day. I was like, no, I want you to do this, I want you to do this. But within a couple of weeks was back doing tricks on the pole, and like blew their own mind as to what they were able to do. And I think it's really important to understand that you don't actually need that much time off after an injury. You just need to be really good, and well, not you, but the physio or the healthcare professional needs to be really good at actually modifying your load and managing it so you can continue. If we look at any other sport, so for example, if we looked at AFL, there's no way we'd be able to have an AFL season if we babied every one of those players through and said, you've sprained an ankle, you need to stop doing everything completely. Like, that would never happen. Definitely. Yeah, the injury list is too high. Most of the year, most of those players are injured or carrying some form of injury. It's just that they're getting appropriate medical management throughout to ensure it's, one, not worsening, and two, actually getting better, so that they can then get the help and care that they need throughout. It's obviously a completely different stage and completely different level. They're getting paid big bucks to push through injuries, but the difference is that they're not injury gaslighting, that they're actually getting the care they need.
I think in my experience with any medical profession, it's all about relationship. And some people, you're going to go to a physio and that's not going to be the right relationship for you, whether it's their lack of knowledge of pole or they just don't align with the same values as you have, whereas they might be like, you need to stop, but it's like, actually, I don't. But you bring up AFL. We're really interested to know, and we've had this discussion a couple of times, how do you see pole in comparison to, let's say, mainstream sport? Like, is it more complex? Is it got the same amount of complexity as anything else? What is your views on pole in comparison to other sports?
It's different, and I think it has its own nuances in a good way. And I mean, personally, I think it's
from a
physio. I was going to say,
sorry.
I gathered it was from a physio point of view, but that's okay.
Both are good.
I was going to say, from a personal point of view, so much better. from a physio point of view, it's different in terms of its nuances. So I think you look at any other sport that's done on the ground. So if we take away for a second any other sport that involves like rock climbing, for example, any aerial based sport, we just remove them for the picture and we just focus on like ground based sports. It's completely different. The most ground based sports, you'll do some sort of form of running. So there's a cardiovascular component from that point of view, as well as impact component. There's usually a jumping component, so plyometric. There's usually a agility, change of direction component. So from a injury perspective, the injuries are completely different with those sports. If we take pole or rock climbing or any other form of aerial based sport, you're now doing something that's completely unnatural for the body. So you're with ground-based sports, we were designed to walk on our feet. With pole and aerial-based sports, we're now taking all of our weight through our hands or our arms. So the best way to explain it, you're basically flipping the body upside down. So if you're doing an invert, all your weight's going through your upper body, which we're not designed to do. So from a physio perspective, the biomechanics and the understanding are completely different. But the basis and the foundation of knowledge is quite similar. So a lot of the things that we do on the ground, like I quite often refer to a break the bar technique in terms of shoulder engagement, that originated from weightlifting. So that's really important to know because that's talking about shoulder engagement, but we can do the exact same thing on the pole. So I think there's definitely similarities in terms of bits that we can take from ground-based sports to aerial-based sports, but there's also a lot of differences that we need to be aware of, and certainly healthcare professionals need to understand when treating a patient is that it's not quite the same. Without going into specific details, it's quite hard. It's quite hard to get that across. But it's definitely there's definitely its own challenges with aerial sports. Yeah.
Yeah, I think a lot of the time when you speak to people, the general consensus is just in discussions is like, pole is an extreme sport, pole is this, like you're doing all these movements, and I think that's what we like to believe, maybe to make ourselves feel like we're doing something unique as human beings. So it's interesting to hear a physio's point of view on how pole is actually viewed. But I guess with any movement, movements, the foundation of them are the same. It's just what's natural and what's not for the human body.
I think a very well-known pole instructor recently has compared an invert to a deadlift. And so I thought that was quite brilliant in terms of the way they did it, because it's a hinging motion of the hips, and effectively you can look at pole movements and take them, like break down the movements and components and go, it is technically just the same movements that we perform on the ground, but now the load has completely changed, and then therefore the demands of the tricks have changed. I think a lot of physios would probably view pole as an extreme sport, but I wonder whether they'd view it as an extreme sport because of the fact that they've not seen it on a main stage or mainstream, or because of potential past stigma associated with pole. So I wonder whether the extremeness is actually because pole's really an extreme sport, because in reality I would say pole's actually not that extreme. You look at some of the stuff that we do with aerial and circus, so it doesn't really differ that much from other apparatuses. It's a hard sport, it's certainly a very challenging sport, but extreme, I don't know. I think that's probably just subjective, really. Yeah.
Yeah, I would agree. 100%. No.
Yeah.
It's interesting.
Sorry, you go.
No, you go.
I was just going to say as well, because I think we have a lot of people come into it that have never ever done exercise before, and then we're going and saying, hey, let's do a spin like this with most of your weight in your arm, or we're going to go upside down eventually and stuff like that. So I think I always say to people, like, when they're seeing girls inverting and being like, oh, I want to just get to that, I'm like, you need to train your body to get to this point. It's not just something you do in everyday life. Children do it, they jump and they throw themselves upside down and they do all this crazy stuff, but it's like, how long has it been since you've done that? if you were going to play soccer or touch or something, you're walking on your legs every day. You might be, you might be running at some point or whatnot, but it's like that is a different adjustment to then doing something you may have never done before. And so I try and say to people like, oh, like this is pretty intense. Like even just doing a climb and a sit, like you should be so proud of yourself. Because you look at the rest of the population, how many people can do that, and like what is involved in doing that. It's so like different to what you're used to.
I think it's relative. I think that's the most important factor there. It's relative to what you do in your day-to-day life. So if you are a beginner pole dancer or intermediate, look, I mean, it doesn't really matter what level. Like you compare it to your day-to-day function, it's extreme in comparison, absolutely. So you can totally then go, okay, well, there's a huge difference versus if you're a pole instructor and you're used to doing some mega crazy stuff on the pole and then you're teaching some beginner intermediate stuff, then you'd go, well, this doesn't feel that extreme. So it's all very relative to the individual, I think. Yeah.
That's so true. So what do you think, what's the most common injuries that you see?
Oh, okay. So shoulders, wrists and hamstrings, like top three. In what order? Definitely shoulders, probably hamstrings and then wrists. So probably that order. In terms of the actual injuries, a lot of it's overuse, overload style injuries. There's very low chance of it being actually an acute traumatic injury, aka like a dislocation, but they do happen in pole. But yeah, I'd say most of the injuries for shoulder are definitely an overload component. Wrists are definitely an overload component as well. Hamstrings are potentially a little bit more acute in there for people trying to force themselves into the splits. So mechanism of injuries of hamstrings is more so split related, whereas shoulders are my body's not used to this and I'm suddenly gone from never doing this before in my life to suddenly trying to do anywhere between 3 to 15 hours a week, which I've seen people overtrain themselves into the ground. So that's probably the number one thing I see there with shoulders.
And in terms of like with the overload, is that them doing too much without rest or not doing enough exercises to then strengthen other muscles around? Like what would be the main culprit for then sustaining an injury?
Good question. So I think everyone comes to me with an injury going, how did I do this? Like, how can I prevent this from happening again? I think we need to always look at the big pillars in terms of the main causes of why we get an injury. And the first is going to be overtraining with a lack of rest. So this is potentially how many sessions you're doing a week, but also potentially the amount of rest you're getting at night as well. And we will refer to the super compensation curve, where for our bodies to actually progress, every time we train, our bodies will deplete in terms of muscle energy. They'll start to break down in actual muscle fibers for then the protein to actually rebuild that fiber and power to then go above the curve. So that's how you actually get stronger. You have to have a period of rest to then allow for super compensation. If you leave that too long, then the muscles will break down again and then we'll be back to square one. The problem that I see is if people train, they then go to, they train, their body breaks down, they then train before they've lifted their body past the line again, they then break down further. So it basically it starts to be this cycle of train, break down, and there's no period of rest to allow for this super compensation to occur. So that's number one, the biggest issue that I see in terms of pole is that people don't know how to train. And this is because we don't have coaches. We have obviously pole instructors, but we don't have the same access to, strength and conditioning coaches in pole as what we would do in any other sport. If even if you're in a very small team, like a soccer team at a B level, you would still have a coach that governs the training load of the whole team, and that coach would basically dictate to ebbs and flows. They may not understand all the nuances of how to load and progress and so forth, but they at least have a plan for the whole team. Versus as you as an individual, you're now having to monitor and progress your own load to your own cycle, and it becomes a little bit more challenging, I guess is what I'm trying to say there. We don't have someone that oversees everything. And so that's where injuries occur, particularly when, when we start out as beginners, it's really challenging. We maybe do once or twice a week. We then start to move towards this intermediate stage, and that's where the biggest risk of injuries usually occurs, is more so that intermediate stage, I find. And that's probably the biggest dropout rate as well in pole. As studio owners, you'd probably agree with that. It's because people aren't, one, getting their inverts and they're getting frustrated, or two, they're getting injured. And it's because they're now asking high demands of their body, but they're also training more to try and get that. So their body's starting to break down as opposed to strengthen. So I think rest is definitely a big factor there. And obviously your progressions and your training load. The next thing is really nutrition and hydration. So if you're lacking those two factors, then your body's going to break down, like without a doubt. It doesn't have the energy, doesn't have the capacity to perform the movement. So they're your biggest factors in terms of injury. Then you're looking at strength. So it's all of these other things first before you think about strength. Yeah. So, yes, a lot of the time our pole dancers, when they start out, they don't have the strength to do the movement, but their body gets stronger. Like, they actually genuinely get stronger, because we all started out not being able to climb or not being able to do a chair spin, but we got there. We absolutely got there. Unless you're jumping from, a very beginner move to trying to suddenly do an advanced move, most of the time the syllabuses for all the pole studios are progressive, and they're not trying to just jump around dramatically. So they're designed in a way that usually follow on from each other. So it usually is everything else first, and then potentially the strength and control and stability. So when I see patients, I usually talk, first of all, one of the questions I ask them is what level they're at, how long they've been doing pole for, and how many times a week they're training / dancing. So I'm trying to find out what their load is, but what their type of load is as well. Because if they're coming to me and saying, I train tricks twice a week and I dance once a week, they're going, okay, well, it's not their load. Their load is actually quite reasonable. What's your sleep like? Oh, getting a good 8 hours sleep. Great. Food, do you have any special dietary requirements? Like, are you vegan? Are you getting, the right amount of nutrients into your body? Great. Ticked all those things off. Fantastic. Let's now talk about technique. Let's now figure out what's going on with your strength, because that's more likely to be the issue there. But I had a lovely patient the other day who basically just said to me point blank that she was training 15 hours a week. And at that point, not only was she injured, but she was severely injured and burnt out. Like, severely burnt out, to the point that her general health had started to deteriorate. And it was only until I was asking other questions that usually physios wouldn't ask, but just about full general health from, all the way from eyes through to bladder, through to bowel, through to, heart, lung function, that she was like, oh yeah, I'm getting these symptoms, or I'm getting these symptoms. And until I started to unravel it, then she could sit back and go, oh. And I was like, yeah, you're really now experiencing what we'd call relative energy deficiency syndrome, where your body is basically breaking down way too much energy for what you're trying to put out, and there's due to a multifactorial nature, and you need to address this in a multifactorial nature, as opposed to just coming to me for a shoulder injury. And so that's what a good physio will do.
I was just about to say, because we were talking to you just off air before about what you actually need to know as a physio. Yeah. And people go to their GPs and like, oh, I went to my GP, and they say, and I was just like, oh, maybe you should actually go to a physio, because they're what they know. And so should physios be then looking at that as a whole, rather than just like that one injury or that one specific isolation? It's like looking at your lifestyle, I guess, or your body as a whole. Should that, when you go and see a physio, should you be expecting that?
Oh, look, should you expect it? I'd like that the physios can get there eventually. I'd like for all physios to be able to get there eventually. I don't think you can expect that they'll do that, because I'm quite an experienced physio with a lot of I've got so much experience in so many different areas, and I treat really challenging patients from an injury perspective. They're lovely patients, but their injuries are quite challenging. So I treat some really complex injuries, and I have gone into a real specialized area of physio, not just with pole, but with the patients that I've treated face to face. And I work under a brilliant specialist physio who has opened my eyes over the last few years to a whole bunch of different nuances with healthcare that are being neglected. I think the longer the physio has been practicing, the more open they will be, and the more knowledgeable they'll be to actually understanding how holistic it needs to be when they're approaching an injury. I think if you, however, saw like a new graduate physio 1 to 2 years out, they may grasp the concepts of this, but they're not going to do it very well. Like they'll do their absolute best for you, and they will be able to settle your pain down, and they'll be able to get, you know, everything under control. But will they understand, you know, how your bladder's interacting with your, you know, skin condition that's interacting with, you know, this or that? No, absolutely not. You know, if you have if you tell your physio who's a new graduate that you have, you know, Ehlers-Danlos or a hypermobility-based disorder, will they understand what that means? Probably not, no. That's stuff that as physios we then go on and do further research and knowledge PD into that area, and then actually understand a little bit more over time. But again, I'm just going to keep on going back to patient examples, but I had a brilliant one the other day who I've been treating now for 4 months, and I think she says to me every time, and she's the loveliest person, but just goes, I never felt seen until I've seen you. Like, I've always gone to a GP with all of these different injuries and issues and medical conditions, and it's kind of been like, since I've started seeing you, everything now is just being addressed. So we've got in a psychologist, a psychiatrist involved to address any sort of ADHD tendencies potentially. So getting a diagnosis there, bladder issues that were previously just fobbed off for many years as potential UTIs that were definitely not UTIs, but actually related to hypermobility, gut-based issues, brain fog, like insomnia, you name it, all the things that a physio usually would not touch and deal with, that as a physio, I'm like, I need to know this information. Like, this is the stuff I want to know, because it actually gives me a really good idea as to how to treat you. And I'm just thinking, I've got like 10 other patients in my mind, but another one who has had a traumatic childhood, and that has completely affected her pain situation today, and has caused multiple areas of pain and so forth. But if we try to strengthen her, it will actually flare up her pain. So a lot of the work we're doing, and with other physiotherapists and healthcare professionals, is actually to settle down the pain nervous systems and to get them a little bit more under control. So as an instructor, you're not to know this, but for example, if you were to have that patient in your class and you tried to give her more strengthening, they're actually you're going to make her worse. So it's really complicated, and that's where that patient needs to be seeing the healthcare professional to then give that information back to you guys. Sorry, I've digressed completely, but my mind goes on tangents.
From that, I'm like, I need to book it.
I was just going to say that is actually like I had no idea that so much could be interrelated at all. So that is actually really good for me as an instructor to know, and I think for others listening that, you know, may not have experienced an injury, or, you know, other instructors to realize, hang on a second, it's not just, hey, go to a physio and just go get sort this out. There could be so much else. You know, there's people that have been in certain levels for a while. It's like, I just can't get this, and I keep getting re-injured here and there. And then, you know, like you said, people end up just quitting because they're like, we love the sport so much, but I just don't see any way, like my body just cannot do it. And I'm like, well, I don't know. I don't have the answers. All I can tell you is to go to someone, but they might not have gone to the right person. So it is very interesting, and it's good for them. So then we can pass on to people. It's like, hey, it might not just be the one thing. There might be a whole, you know, lot of underlying things happening, to make sure, you know, you find someone that you trust, and that is looking at all these other things and talking to you about what you want to do as well, not like, you know, not just what they think you should do. In terms of, like, for example, when I was competing, I thought I might have injured my shoulder because I was doing a move over and over again, trying to practice, wasn't getting it. Went to my physio and I just said, look, if you say it's too far gone, like I'll pull out of the competition, like I need to teach, like that's like half my income at the moment. And he was like, no, like if you want to compete, we're going to be able to manage this. Like, he obviously assessed it first, but like I built trust with him from a previous one as well. Like, and I've never been to the point where I've actually been sustained like an injury. It's always just been preemptive, and I'm like, oh, this doesn't feel right. And he's like, you're my best patient. You come to me before it's too much of an issue, and then we can work around it. We can identify where you're lacking and why it's causing this. And he's actually like a lower limb specialist for like runners or something, and now he's just sees all these pole dancers because a few of us have gone there, and now he's like, but he's fully researched it, and he's like really passionate about it, and that's why I'm like, I trust him, and I keep going back because he's not just like, oh, we'll just do this. He's just like, wow, I've become a pole dance expert now because of how many people have come and how much research I've done. And he's actually doing with one of our instructors we know, like a lot more research into like Rainbow Marchenko and putting her in this weird position to understand like the body movement and where it, like how her body is. And it's incredible. So
I love that. I love that so much. Like physios like that, I just like hats off. That's exactly what I want to be seeing out there. And there's definitely like, if you haven't found the right physio, then keep looking. Please, like the one pet hate I have is people going, oh yeah, I've tried physio, it didn't work for me. You haven't tried physio. Like one person is not physio. There are many different types of physios out there. There are, you know, like there's many different relationships you can have with your healthcare professional. Keep on trying till you find that one for you. But I love that. But injuries are complex. That's probably the one thing I want people to understand from this podcast. And like, I long for the day that I see a basic ankle sprain. Like I've joked with my junior physios about that when I mentor them. Like, I don't know what that is anymore. Everything is just, there's more to it. And as soon as your eyes as a physio are opened to other options and potentials, you start to see more that you potentially miss. Like I look back at some of the things that I've treated, you know, as a junior physio, and I go, oh, I missed this. And I can very easily point out times when I've just missed this, but now I know better, so I can fix things so that it doesn't happen like that in the future. Yeah.
I find the more we dig into pole and the more we understand it, the complexities, and we're growing as an industry. We're still such a baby industry, but I find that we're going to eventually struggle with this definition of fun fitness. And if you actually look at most pole studios, that's how they advertise themselves. This definition of fun fitness, how are we going to mix that with really well thought out injury prevention? Because I think like as a studio owner, that's where I want to see it go. I want to see us get better with injury prevention within our curriculum and within our studio and our classes through education and through changing curriculums and stuff. But as a studio owner, I'm also like, I know girls come here because they want to feel sexy.
Absolutely.
So how do we then find, and we might not have the answer.
I've got the answers.
I'm like, good, because I need them. Yes, you're just going to answer everything we've been like pondering on. But like,
what's the meaning of life? 42.
But I feel like that is one of the biggest challenges. And when we reviewed the pole PT's summary of research, that was the biggest thing I came out with. I'm like, how do I then as a studio owner find this balance between keeping these girls safe? And I say girls because we're a female-only studio. And then, like giving them this fun fitness, because there are going to be people, I don't know, it's a balance.
They will come once a week. They're working full-time mums and, you know, they've got other stuff going on. It's just a hobby for them. So it's like the hobby and then people that are kind of a little bit serious and then people that want to compete, but then they also work full-time and then people that just want to go, like there's not many people that are full-time in pole and can dedicate their whole lives to doing it. Yeah. So it's like, where's that balance as well? And keeping it fun, but as well as making sure that you're, you know, longevity for your body, really.
So I think, first of all, breaking up your market audience. So from a business perspective, actually having them as these are the ones who come for fun, as a pure, like once a week they come for a dance class, versus the ones who are once or twice a week, they're a dance and a tricks class. So you can, first of all, you can actually break them up per what they're wanting out of pole, what's their reason for why they want pole, what's their prime reason, and then you can figure out how you can tailor to those needs. There are classes that studios can run and can look into running that there will be students that sign up for, and you would be surprised how many students would sign up for it. But if you like run a rehab class, a pole rehab class, they're actually quite popular because it's a cheap and affordable way for a studio to run a class, get people in, and to do physio at the same time. And you don't have to be a physio to run those classes. You can be someone with a really good understanding of strength and conditioning, and they can be predominantly focused on shoulders. Yes, looking at you.
I've got one.
You've got one. But they can be predominantly focused on shoulder wrist strengthening and hamstrings, because they're obviously our biggest injury concerns, right? So that's the first thing, is like studios can run these rehab classes, and you would be surprised on the uptake, because for a lot of people, they actually feel good on their body to do in addition to their normal schedule. It's not like it's not ruining fun fitness, but it's a choice, right? As opposed to forcing it upon them in the class, you've got a separate class they can choose to book into. And you'll find that the people who are serious, the ones who are here for competition and to get better quicker, they're the ones that are going to uptake, as well as potentially those who are injured who have to reduce their class load, or maybe they can't do a certain class because of an injury. They've got then a backup alternative. So that's one answer right there. There are multiple answers to this though. So for those who just want a fun fitness time and to feel empowered and sexy and, you know, everything that we want pole to be, don't force it upon them. They don't need it. They're just there to dance, and they're there to have a good time. So for them, they're happy, right? We can leave them be. They'll get stronger from just doing dancing, and they're there really for cardiovascular fitness and just to feel really good. For those who are doing those multiple tricks and strengthening classes and, you know, maybe a little bit of dance and acro or whatever you want to work on, they're the target audience. They're the ones that we really need to look at. And they're the ones who are potentially trying to power through the levels and maybe not for their own good either. They're trying to push themselves to new extremes and too quickly. So they're the ones that we want to make sure that we have some form of conditioning in. So there's a couple different ways we can attack this. We can, one, throw conditioning into the classes, but don't tell them it's conditioning. And it can, I mean, they'll figure out it's conditioning pretty quickly. Yep. Don't call it injury prevention. That's the number one thing. It's performance enhancement. So as soon as you stop referring to this as this will be good to protect your shoulders from injury, as a this will be good, it's going to make your shoulders be able to push better in your Aisha, or, you know, to be able to get you ready for the demands of this particular trick, they're more interested. And what we know is that these conditioning exercises can enhance performance for up to 50%. So basically this knowledge of what you do off the pole to make it replicate the demands of what you do on the pole can boost and power performance and get you there quicker and much safer. So we know it's injury prevention as physios. I shouldn't say prevention, by the way. I should actually, big asterisk sign right here, insert into the podcast. You can't prevent an injury. I do need to say that as a disclaimer. You cannot prevent an injury. You can reduce the risk of injury. Okay, so just off my little rant there. But we talk about it as injury prevention because injury risk reduction doesn't sound as sexy. So injury prevention. So if we can do things off the pole to enhance their performance, they're happy because they're getting there quicker. But in the meantime, as a physio, I'm giggling and, you know, clapping my hands, you know, with glee, going, brilliant, I've just reduced their risk of injury by 30% because they are much stronger and they're actually way more stable with this position. So that's how you sneak it in. And it has to be just after the warm-up. And there can be off the pole conditioning and on the pole conditioning. So they are not going to like it because it's hard, but the ones that are genuinely trying to push for new tricks and new levels, and, you know, they're the ones that will go, okay, I need this, and they'll know they need it. Absolutely. The third thing you can do is go, okay, you're really injured. You need to see someone and they need to work with you long term. Once the injury is fixed, to go, okay, no pain anymore. Let's figure out why this happened in the first place, address those technique issues, address any strength deficits, work on your rehab program. But that is not on the studio to worry about. That's completely when you go and then put it on someone else like me and go, okay, this person, they need work. And I'm like, yep, no worries, let's work on them. I can feed back to you information and go from there.
I think there's so many good points in that. And when we reviewed our pricing last year, and one of the things we did in that review was if you do one class a week, you're never going to progress. So we actually made our minimum pricing 2 classes a week, and we don't actually publicly advertise unlimited class, like an unlimited package. We do have one, but it's sort of a side thing, because what I was finding when I first took over, because I only took over last year, was people on an unlimited package were coming like 15 hours just to pole class a week. Like they were coming to 15 classes a week. And I was just like, whoa, I actually think your sister was one of these culprits.
Yeah, she is.
But I was just like, that's not okay.
Nah.
So like we structured our pricing to be like, I think what most people are on are like 4 classes a week, which I think that's our middle one and that's the most ideal. But we have like a 2, 4 and a 6. And I think I have one student on the unlimited, but she doesn't go crazy for it. Like she doesn't go over the top with it, but like it exists. But we're like, realistically, this should be what you're doing. So I guess as a business, we're forcing them to slow down rather than go and just go crazy on an unlimited membership.
And that's really important for many different reasons. But if your clients are broken, they're not going to be your clients. Like, you lost them. I mean, it's great to earn money, sure. Like, and I always still have, like, you know, physio hat, business hat, personal. Like, I've got all the hats, but from all three of them as a business owner as well, you'd go, that's not going to be helpful for the business. Not to mention it encourages really bad behaviors. 15 hours a week. Elite level athletes do not train 15 hours a week. To give people an idea. So for anyone out there who thinks training, you know, that much is good for them, I can tell you right now it's not. You're going to end up in a chronic burnout situation. It's not okay. So everyone's ideal training amount, because that will probably be like, you know, how many hours should I train? It's dependent on your individual circumstances. So I can't give you an ideal number. I think the 4 is a roughly a good number. I would try and, for certain classes, do maybe 2 back to back. If you've got a lighter class and then maybe a medium class, I would try and organize it like that so you can have some more rest days in between. But I think sort of, you know, even the 6 is appropriate for certain people depending on level. But for like a beginner, 2 classes is appropriate. So it's going to depend on individual needs. But yeah, 15's ridiculous, and that's just asking for trouble.
It would range between like 10 to, there was a group of them, and I was watching this happen, and I'm just like, oh, I don't know if I feel okay with this.
I know. And one of the main takeaways I learned from when I was doing my strength and conditioning is the effectiveness of workouts is you can make it so much more effective in a nice short time. Like, people think, oh, I have to be 2 hours training. It's like, no, you don't have to be 2 hours. If you could do a really effective workout, you can do it in 45 minutes. Like, and even depending on what your goal is for that session, you don't need to be dragging it out and doing 2 hour, 3 hour long, you know, workouts and exercise and all this sort of stuff to get better. It's like, you need to just focus on being more effective with your training.
And it's really interesting because I 100% agree with that and argue that point. I know a lot of pole classes out there are hour long. I actually think we should have 45-minute pole classes because we can nail it really nicely in that 45 minutes. There'll be some classes where absolutely 60 minutes is appropriate. But if you are doing, for example, if you're doing your own training session, warm up, you get into it, you do your tricks, you should have pre-planned what you're doing for that session. The biggest issue is when people go to training, they're like, I'm just going to go to training, I'll figure out what I want to do and you're listening to your body, which is great because your body's telling you what you can and can't do on the day, but you're more likely to overtrain when you do those sessions because next minute you're there for 2.5 hours, repeating the same tricks 12 times. It's not going to be okay for your body to do that. So I think it's really important to have, like, you would not go to the gym for 3 hours. Like, if you are, you've got something wrong, we've got to figure that out. That's a side note, but
you're lonely.
Or you're one of those weightlifters that's taking a lot of time of rest between sets, and that's different. That's like, you know, bodybuilders, that's completely different unless you're a bodybuilder. Yeah. If you're a normal average person going to the gym, you should not be there for 2 to 3 hours. That's for sure.
No. Yeah, and I know when I train for competitions, I can be in the studio for 2 hours, but half of it's planning, and then we film something and analyze it as well. So there's differences between that and, you know, doing an effective workout, which again, like you're saying, come pre-planned. What is the purpose of this workout? And obviously in classes, they don't need to think about that. It's already planned for them, so that they can expect to show up and be able to have everything there already for them.
Absolutely. And then if you have that off the pole conditioning section after your warm up, that then reduces the amount of heavy load that they're doing on the pole during the session as well. And if they're struggling with the on the pole component, then you obviously as an instructor can provide regressions for that, but you can also refer them back to some of that off the pole conditioning work so that they can use that to get stronger and make it a super effective and efficient workout. If they're not feeling like they've worked out after that 45-60 minute session because they're one of those students that hangs around and does nothing really during the class, and they watch the instructor 5 times do it, they maybe do it once or twice themselves. They're on their phone. they're like me, and they're gripping and they're wiping down the pole up again and they're gripping again, you know, and sweating profusely. If you're like that and you're only doing it, means you could be doing something else during those sessions. You don't have to be working at a maximum capacity constantly, but you can be fitting in exercise in other different ways. Yeah.
That's true.
And it's funny that we say like they need to be reduced because we know our instructors are like, I can't fit it all in. So it's a really interesting perspective to hear what like somebody who, if they could do a perfect world based on their knowledge and the knowledge you have, what it would look like. So,
Exactly.
very
And sometimes
interesting.
perfect world based on literature and paper doesn't actually equal perfect world in reality, and that's so fine. So
100%.
don't come for me if you're like 45 minutes is not enough. It's okay. 60 minutes is fine. I'm just saying in like an ideal world, 45 would be perfect.
Yeah.
Definitely. And also, I want to talk about the risk of re-injuring after you have sustained an injury.
Oh, that's a good one.
It's one of the biggest ones. And I say to people that you be careful, like, because after someone has been injured, even if they have seen someone, maybe they're, just seen someone a couple times, they said, okay, my physio said I'm just going to keep doing these and I feel good, I can keep going. And then I usually stress, I'm like, just make sure you're careful, because right after that injury, even though you feel like you might be 100% again, maybe not throw yourself back into what you're doing before. You might need a bit more time. So what would sort of you have to say about that?
It depends on, I guess, the injury and the person. And I think it's a really good point, because for me, if that person has sustained that injury by pure freak chance, for example, they were walking down the street, they've sprained their ankle and they have no history of ankle instability, they've never had anything like that before, they're tripped over a gutter, then there's nothing else that I have to address prior in terms of past history. They're coming into me with a pure ankle injury that I go, okay, we've got to rehab this, we've got to make sure you're at full strength before you can do certain tricks and movements. Easy fix. Versus someone who potentially, they've come to see me, they have the overtraining factor, they're not getting enough sleep, their nutrition's not brilliant, but then they also have some technical issues in terms of their technique and their strength behind them that they're lacking. I need to not just rehab this injury and get them pain-free, I need to address all of these other issues, otherwise their risk of injury is huge. And that's probably the one thing I would just keep on, I guess, pressing, is that you can get rid of pain, you can rehab it, but the risk of injury will still always be there. It's just, can we mitigate the risk as much as possible? And what we do know from research is one of the biggest risks of future injury is a past history of the injury of the same, on the same side or opposite side. So for example, if we talk about ACLs, the research is once you've ruptured an ACL, you've got quite a considerable risk of rupturing your other side. And it's not because your ligament's weaker or so forth. I mean, it could be genetically, you might have a weaker ligament, I shouldn't say that, but it is because of your behaviours. So the risk, the chances are that you've injured the ACL based on how you cut whilst you're running around on the ground. So your agility, your strength and control around that knee and the hip, that places you at the risk of the injury. So it means that whatever you're doing on one side, you're probably likely doing on the other side. And so when they end up doing a recon, or whether they rehab it without a recon, that ends up being stronger because of all the rehab, but they've neglected the other side. So just little factors like that. And there's a lot of research that's being done on this, like hamstring injuries. There was a paper done recently, that was talking about running technique and a few other age factors as well as, age-related factors as well as past history of injury. So there's a few different things that increase your injury risk profile. So particularly with shoulders, so if we bring it back more to like pole, so if you've got modifiable risk factors is how I would explain it. So if your shoulder blade, if the muscles around it, they're not working correctly, so scapular dyskinesis is how we would explain that. If you've got weakness in your external rotator muscles, if you have dominance of your internal rotator muscles, if you're overweight, your risk of shoulder injury does increase. If the nerve to muscle connection and the motor control component behind it isn't there, if your load is high, and then if your training history and your pole level history they're not quite matching up to a nice standard, your risk of injury is high. But those are the completely modifiable risk factors that I need to then address as a physiotherapist, either before you go back to pole or whilst you're at pole, trying to reduce the risk of injury. There are also non-modifiable factors that people have that we can't fix, but it's important to know. So like gender does play a part. Your age does play a part. Your genetics do play a part. Your menstrual cycle plays a part in terms of your injury profile risk. Previous history, family history plays a risk. Your anatomical history. We have variance in an anatomy. So we have these beautiful anatomy pictures as to what everyone should ideally be, but in reality, that's not actually the case. Like we are actually quite varied, up to 30% to different people. Smoking. Your smoking history actually increases your risk of injury, and hypermobility obviously increases your risk of injury. So these are the things that we can't change, but we can work around and try and do everything as we can as possible as a physio to try and actually reduce that from recurring. I'm so sorry. I've gone on a massive tangent, but this is everything I think about. You can see why sometimes my brain wants to explode.
I'm just like,
I love this.
You keep talking?
No, I love this, and I almost like sometimes I'm like taking some notes. I'm like, wait a second, I could just listen to this again.
I feel like I'm going to have to listen back.
But I love all those, especially the modifiable ones. I think that would be really, really important for more instructors to just be aware of and know. Like, for example, the one you said about, I forget what word you used, but like pretty much like the coordination side of things between left and right or the other side. I know that one side I feel better on. When I train, I definitely train both sides. I have a preferred side, and I always go back to teaching on one side, which I need to try and retrain myself and teach on the other side as well, because I just go to that side because I feel comfortable. But then when I go to do stuff on my other side, I have the strength there and I'm training everything equally, but it feels awkward and it feels uncoordinated. So that would be like a risk of injuring that, like something on that side, if I don't feel comfortable with the movement, right?
Yeah. How technical do you want me to get? Go for it.
Go for it. Yeah. Just like, let's see everything. I think that's a really important part though, because like so many people, even though, especially in our studio, we really, really encourage people, force people to do both sides, but we still have that, you know, awkward side, dork side, preferred side sort
we
of thing.
did poll our Instagram community recently, and there's still quite a few people who don't train both sides.
Oh, man.
Yeah, we were the same. We were like,
I challenge anyone who's listening for their next poll session to go in starting to train their non-preferred side first. So do as many reps as you have planned. Do it on your non-preferred side first before you're exhausted, and then finish with your preferred side. Just see how you go for a session. And obviously you're not going to be as good on your non-preferred side, but just give it a shot. See how you go and try and get in the habit of doing that, because it is really helpful. I mean, I can get really technical in terms of explaining the brain and how that all works. And I think it's probably the one thing that's really important to understand is that on our brain, we have this part called the somatosensory cortex, and it controls your sensation as well as your motor control. So everything that you're doing or feeling, it's controlled by this part of the brain. And then in this area, what we know is that if you go to train your preferred side, it actually lights up the pathways on your non-preferred side, and vice versa. So if you're using your left shoulder to do something, that's my right shoulder, but if you're using your left shoulder to do something, it's going to train your right shoulder to a certain degree. And we use this for rehab. It's called plasticity of the brain. So we actually use it to go, okay, you have, for example, the really severe ones where they've gone to surgery for something, or they've broken an arm and they can't do anything. Strengthen your opposite side, because it actually makes changes to your injured side. It is mind-blowing, right? But still, there's nothing that, you know, says strengthening like actually doing the side that's injured or that side that's not preferred. But what we know is that if you train certain parts of your body, it actually lights up different pathways on the brain that actually helps to speed up the foundations of strengthening. So it's really important from a neural component to actually be strengthening things on both sides and not just neglecting one. But yeah, it's absolutely fascinating, the science behind, I guess, neurocognitive function, but motor function, that's all processed by the brain. Just remember, everything we do is controlled by the brain. Any injury that you're experiencing is controlled by the brain. So with that knowledge, you know, comes then the power that you can always control things. And you hear the very motivational speakers, and they just have such a good understanding and control of the power of the brain and how to harness it. It's fascinating.
Oh, yeah, the brain, we could talk about for days. Mindset is so important into anything you go into. But we'll stick to I'm not even going to start because I'll be there for a while.
I should probably add on to that, like in terms of if you are strengthening, if you anytime you're working on your non-preferred side, you're basically reinforcing those nerve pathways from the brain, and that's why it's important. You're not just strengthening the muscles, but you're reinforcing those nerve pathways, which make it easier to activate the muscles. That's why it's so important. I'll probably add that bit in.
Yeah.
And I think people just get so excited by, like, when you start pole and you start achieving things, you get so excited and you're like, I just want to keep doing it. It feels good. So they keep just targeting that side to be able to keep getting that positive reinforcement that pole brings to them. But Renee said something before about the modifiers and how it would be important for instructors to be aware of this. You do have online personal PD development thing for instructors or studios.
Yeah, there's not a set course at the moment. I'm in the process of creating another course on shoulder injuries that I'm actually going to be running through Indie Poleware. So it hasn't been announced yet. So I'm hoping by the time that this is this is public, it will be announced. That's okay.
We can make that.
Can make that happen. No, it's okay. It's fine. It's going to be announced in the next few days. I think it was October 4th, so it's not too long away.
Oh yeah,
we're good. But yeah, they're happy for me to pre-announce it anyway. So I'll be doing a workshop on shoulder injuries and particularly, again, injury prevention, how to sort of save our shoulders and reduce the risk of injury. So people can certainly tune into that one. But in terms of, I think it's really important for studios to have this ongoing PD for the instructors throughout. So it's different to just sort of understand your own body, but to teach someone else how to pole when the industry is not regulated. You don't actually need anything to become a pole instructor other than ideally to be somewhat reasonable at pole. So it's currently not regulated in Australia. So I think it's really important to do as much as we can to give our instructors as much as we can in terms of knowledge and foundation, because they're now responsible for other people. And if then, someone gets injured on their watch because they're instructing them incorrectly, then that's obviously on them. It's really important that we, as studio owners, give our instructors as many tools as we possibly can to make sure that doesn't happen or reduce the chance of that happening. So, yes, I basically run PD sessions for studios, for the instructors. A lot of the time I've been asked to provide sort of presentations on shoulder injuries specifically, because it is obviously the big one in pole. I did one in New Zealand recently, which was brilliant, in New Zealand being virtually. I have not left Melbourne for a very long time, but did one for a great studio over there who were brilliant, and we talked about, ideal training for warm-ups. So like how to actually run a warm-up and how to make it as specific as possible without, blowing out the time of a warm-up. So how to get everything working for the students as best as possible to reduce the injury risk. But I'm happy to pretty much tailor PD sessions for studios. You could probably tell by this podcast, like I know a lot, sometimes too much, but I know a lot. And so I'm happy, you name it, I'm happy to talk about it. Like obviously I provide a lot of information for free out there with the aim to change the pole, industry and how people treat their own bodies and how they, treat other people's bodies. I want to reduce the risk of injury, but the best way to do that is actually through the instructors. And so I love it when I treat an instructor, because I'm so aware of the fact that everything I'm providing the instructor, they're then passing on to, a couple hundred people, and they're making a real big difference there. And I think what's, one of the most adorable things that's happened in the last year is I've had a student of one of my patients message me out of nowhere saying, hey, you don't treat me, obviously, but I just want to say thank you because of everything you've given my instructor. I've now been able to achieve this, because they now make us do that in the conditioning component. I also hate you, but I really appreciate you. So I was like, that's adorable. I love that. And I can understand the hatred. Wow. But like they're hard exercises and they're really good conditioning exercises that they've been able to go on. So I'm happy to do stuff like that with studios, and I'll be eventually creating my own actual like full day length course at some point, which is you can imagine, take me a long time to do because there's so much information. But I'll have it out there that instructors can look at doing. I'll have like a half day version as well. But yeah.
Just sign me up.
Yeah, I'm already like writing down, okay, warm-ups, we can get on to the team about this and this.
Yeah.
But yeah, no, you do have a lot of knowledge, and I think it's amazing how much of that you are, and I understand it from a business perspective too, like you want to make impact, and that is one of the biggest reasons that you've come into pole to niche into this in particular, because you see that there's a gap and you see that there is a huge educational gap. So you did say that it's not regulated in Australia. Do you know if it's regulated in any other country yet?
I don't know if it's regulated, but I know that there's some studios that require you've done like an expert level 1 course before you teach. So I'm not 100% sure if it's a mandated thing, but I know that some studios have, in Europe particularly, will require that they've done certification courses. And it's something that I get asked constantly on Instagram. People message me and go, hey, do you run a certification course for pole dance instructors? And like, I want to put out there, I'm not a pole instructor. Like, one of my beautiful pole physios is a pole instructor, but I'm not here to teach you how to actually do a trick. I'm not here to teach you how to pole. I'm here to make sure that you're doing that trick to the best possible ability to reduce your risk of injury. But I'm not here to, certify you to be like, yeah, you're, perfect to instruct now. But I'm here to help you as an instructor to then teach your students how to reduce that risk of injury. So I think that's where the pole industry needs to go. I think what I would encourage is that a personal training degree by bare minimum. Saying that, I did mine 10 plus years ago, and I did it whilst I was studying full-time as a physio, and I smashed out within a week because of it was easy. Like, it was one of those things that I did. So I think that the basis of knowledge that PT courses have these days are unfortunately quite low. Hopefully it's gotten better, in 10 years. But what I'd love to see is that pole instructors have an S&C background effectively, because that's what they become. They become strength and conditioning coaches. They may not have to be like a full strength and conditioning coach, but like I want there to be like almost a stepping stone. There needs to be some sort of course out there that actually explains the foundations of strength and conditioning, which is another course I've done. so strength and conditioning foundations is important. That combined with pole technique, combined with a few other things, that would be perfect from a certification point of view from a pole instructor. And hell, I could absolutely make a certification course up there and then hand out, shiny pieces of paper and be like, you're now certified as a pole physio instructor. I could do that, and I could make a whole lot of bank from doing that. I won't do that because I just think that's selling the industry short and trying to, create something that actually isn't like a legal certificate. So I think there needs to be something that the pole industry effectively agrees on, and we get there eventually, but just there has to be a bit more of a whole rounded consistency as opposed to just a basic personal training degree. I shouldn't say that because personal trainers are great. Sorry if anyone's listening and they're offended. I'm not trying to downplay personal trainers. Sorry.
No, but this is, pole's very so specific,
it's so specific
as well. So, and I think that you definitely do need very specific training to then be able to teach this as well. And I think having a PT, because we have lots of PTs that come in as students and they're like, whoa, like we have no idea how to do this. Like it is very, very different.
Yeah. And I think the other thing on top of that is you can go do a pole certificate. So all of our instructors have pole certificates, but it's the continuous and the requirement for continuous PD that just doesn't exist either. So it's cool. I got that 10 years ago. It was a great base of knowledge, but how are you proving you're upskilling that, I think, and continuing? You do learn on the job for sure. But yeah, like me personally, I'd like to see the pole world have a much more regular personal development. And as a studio owner and seeing that in my girls, we do try to put a lot more into it in the studio, but sometimes it can get hard because for a lot of instructors, especially in Brisbane, it's their second job. So the time they can invest into it is difficult. But yeah, I think, it'll be crazy to see where it ends up in a few years' time.
I was going to say, and it is quite hard to make full-time or even like a part-time job out of pole teaching, because then you're teaching so much that depending on what you're teaching might require you to physically be able to do something as well. Whereas, some personal trainers obviously can explain it with like less weight, and when you have people doing regular sessions, you might not be and like that's the sort of challenges I know I'm sort of coming across a bit more now. Whereas when everyone wants to do like private lessons with me, they always want to learn these tricks that they haven't done before, and I have to demonstrate them. I'm not going to teach from a phone, or I can't just explain it. I have to show them to a certain extent, which means I need to prep my body and get warm, which is also taxing on my body as well. So I think it is definitely a lot harder to be able to just teach pole, especially just teaching pole tricks, like 15, 20 hours a week. It's too much for your body.
Yeah. It used to be so different many years ago when I guess it was more that nightclub scene that had then just sort of walked into studios with the aim to teach girls and guys, and it was very different, I guess, back then, and it was less about the fact that this is a sport and more about the fact that this is a bit of fun and a little bit of strength and a bit of sexy. Like that was really the focus then. Now it's so much more. It's still a whole lot of fun and a whole lot of sexy and a whole lot of, you know, this and that, but there's just so much more to it now. And I think, yeah, that's where it's got to change. That's for sure. Yeah.
Yeah.
And
solve the world. We can solve the world pole problems.
I do want to really jump back to, I really want to talk about this, the concussions.
Oh, yeah.
So you just did recently put out this thing about, and it was actually a really long read, which I sent it to our instructors and actually sent it to a few people. And I just said, it's a long read, but it's really worth it because I learned so much that I didn't know. And there's so much like coming out there now that, especially when you're sort of doing these blogs, that it's kind of like, oh, you didn't even realize it. So when Simone put out this thing about concussions in pole, think of like, say if you've like fallen for one, but the big takeaway from me is you don't actually have to hit your head to sustain a concussion, and how serious a concussion can actually be. It's not just whoops, I just fell and, I'll just sort of rest. Do you want to give a little bit of a talk about about the concussions?
How much do you want?
I'm sorry, we had a massive chat earlier, but just in terms of like what a concussion might look like and the severity it can be, and that we need to sort of be a little bit mindful as instructors and as pole dancers ourselves that we could potentially be sustaining a concussion and the implications of it.
Oh, you're asking for not some big things there, are you? That's okay. I'm actually bringing up the blog as we speak because I, like any questions regarding to concussion, I kind of want to do it justice. And like you said, it is a long blog and it's long for a reason. I actually wrote this blog many years ago, not related to pole, but I did it related to just any form of contact sport. And then I rewrote it for pole physio, and then obviously made it really pole specific. And then in there, I put that little graphic that I created about, the ideal return back to pole from concussion. But, there's so much. Break down your questions again for me. Let's start with one of them at a time.
So initially, what sort of, how can you sustain a concussion in pole?
So you can sustain a concussion in pole from either one contact to the head or two contact to any part of the body. And that's really important to know. So you can fall onto your shoulder and not hit your head, and you can still experience a concussion. And the way that happens is the force that you, get impacted with causes your brain to move around in the skull. If you kind of think about it like being jelly inside a, hard case, it's going to have that sort of whiplash effect back and forth and side to side. And that in itself is what causes a concussion. It is that sort of knocking around of the brain inside that hard skull. And that causes local inflammation to the brain. So kind of like how we'd expect to see swelling, but it can also cause some other issues to the brain itself. So it's not always just about the swelling in a small area. So it's really probably the big thing there is, yes, so you don't have to have a hit to the brain to get concussed, but you also don't need to lose consciousness to get concussed. And that is a huge one that people just underestimate. There was some research done in AFL. Again, I'll keep going back to AFL because I have previously worked in AFL. But there was a study done that showed in elite level athletes that only 40% of them lost consciousness. Now, these guys are hitting hard. They're hitting out like on purpose. Like they're obviously not trying to attack the brain, but they're going in with intent. So the risk of them having loss of consciousness is probably quite high. So 40% I'd actually say is still quite high in terms of 40% of them losing consciousness. I imagine that most concussions, there's probably about a 10-ish% rate that actually probably lose concussion, maybe up to 20% is probably from my clinical experience. Not all of them lose consciousness. I think I said loss of concussion. Loss of consciousness is what I meant to say if I said that wrong.
Understood.
Thank you. So that's really, really important. So yeah, that's the first question.
Yeah, and so then what can it look like? So what can you sort of expect to potentially experience if that has happened?
Cool. There's a few symptoms. So the most common symptom is headaches. I think that was prevalent in about 80-something% of that particular cohort. And it may be anything from the mildest headache, so mildest, faintest sensation of discomfort through to like anywhere in the head, through to ear splitting headache. It could be dizziness, and again, it's not constant dizziness. It just might be that you stand up and you go, oh, I don't feel quite right, and it could be a split second of dizziness. That's a concussion, okay? Assuming that there has been a cause for concussion afterwards. Some of us get dizzy from just standing up. So you have to sort of base it to compare to what's normal for you. Vision issues, so blurred vision. That's probably the big one that I look for straight away, is not necessarily if they're reporting blurred vision, but when someone's concussed, I automatically look for, are their eyes following a normal pursuit of movement, like what's happening from a neurological pathway perspective. If there's a concussion, that gets disrupted, and I can see usually quite some visible issues, like as a nystagmus where the eye might be juddering back and forth, or the movement isn't as smooth as what we'd expect throughout. Drowsiness, brain fog, feeling confused, like an amnesia can happen even. So that's maybe not as common, but it's still there where people go, I don't know what happened. And again, they're usually the ones that I would have seen out on the football field. And I saw some beautiful ones in my time where they would walk off, and one in particular that we monitored before sending to hospital, and I would ask him the day, I'd ask him the time, I'd ask him, roughly all those things. Who scored the last goal? And he's like, where am I? And he would ask me that every 3 to 5 minutes. He's like, what am I doing here? Wow. Yeah. Be like, hey, buddy, you're here at the footy. Like, where the game's got, so have I played? Yeah, you played. We had to take you off because you did get a head knock. And every 5 minutes, like the other players on the bench thought it was hilarious. At the time, I'm going, oh my gosh, this is quite considerable amnesia. So I'm going, this is quite severe. They thought it was adorable. Looking back, it's adorable. You can laugh at it. But at the time, I'm like, this is quite serious. And then he deteriorated and he ended up in hospital, and he's fine. But like, that's not common. Like, it's not common. So I think out of all the concussions I've seen, and I've been privy to quite a few, that's maybe happened twice in the concussions I've seen.
Yeah, and you said early off air when we were chatting, potentially being emotional as well can be
huge. So I was saying to you ladies before that one of the AFL girls got concussed. I think it was either during training or maybe, it was actually after a game. It was the day after a game, but no one realised she was concussed during the game because she didn't get hit in the head. And there was no impact, nothing that you would have questioned or queried. She reported completely fine after the game. There was just nothing to give us indication. And then the next day basically walked into the club room and took a look at me and just was like, I don't feel okay, and just started crying. And I was saying to you ladies that this person wasn't a crier. It was just completely out of character for her. Not that any of the girls would just walk in and start crying, but like there's definitely some people who, like, things happen in their life, they start crying. Not her, not her at all in any way, shape or form. And we basically, I spent like 2 to 3 hours with her, like, crying in a ball effectively, trying to calm her down and breathe. And she was like, I just don't know why I'm so upset, but I'm so upset, and just uncontrollable. Again, that's an extreme of concussion. Like, you don't get that usually, but I have seen people be like more irritable, more snappy, like, they just aren't quite themselves. And it's quite interesting because I'll pick up with them and I'll say, they're concussed, and I'll say to them, look, you're experiencing concussion. They're like, no, I'm not. You are concussed, you're experiencing it. Oh, okay, sure, fine. A week later, they'll come back to me, they're like, wow, I was concussed. And I was like, yeah. The best one I've ever had is a 16-year-old boy who, at an AFL game, he, his league, he just started swearing at me. And guys, when they grow up, you kind of expect it in footy. Like, you just, like, whatever, you throw it off the shoulder. He turned to me, he started swearing. For a 16-year-old boy to do that, I was just like, no, this is not normal for you. And I just went, if you didn't think you were concussed before, you just gave me even more ammunition to basically keep you off for the rest of the game. He was beside himself. Within 5 minutes, he was in tears going, oh my God, I can't believe I said that to you. I'm so sorry. Like, he was beside himself. And that's him usually. Like, he would never swear at me. And I knew him well enough to know he'd never swear at me. But that, he was like, F this. And, and I was like, wow. So there's just, like, you look for personality changes. And I think as a healthcare professional, you look for people that so when you work in a team sport, it's easier to pick that up because you know these people. When you're instructors, you can pick these things up because you know these people. So if something doesn't feel quite right, you just go, look, you need to get checked out. But if anyone experiences a fall from a pole, the number one thing is they should stop poling. So if they experience a fall, regardless of whether they hit their head or not, they should stop poling. They should get assessed. by a doctor, not by a physiotherapist. I've got a great skill set in concussion that allows me to work with medical professionals at my level, but not physios don't usually have that. So it has to be from a doctor who ideally is experiencing concussion. A sports physician is also a great place to start for anyone in Australia. That's sort of our healthcare system. In other different countries, so in Europe, it will be different healthcare professionals. But get assessed. Even if you have mild symptoms, it's still a concussion and it can cause havoc. If you try to pole through a concussion, you can be experiencing concussive symptoms for up to a year, if not longer. So post-concussive symptoms.
I was only listening to a podcast recently, and this particular girl created a whole membership program of her concussion experience because she got to debilitating state for like almost a decade. So she walked out of the hospital like, it's just a concussion, it's fine. And it actually progressed and got worse and worse and worse. But I have a good question off the back of that. When should somebody go to a GP or a physio? Like, what would be, like, that's because we would be like, go to a physio. Because my experience with some GPs is you go there and it's, here's some painkiller, like there's a prescription given to something, and then you just move along, sort of thing.
Stop doing.
So I think the question is, ask yourself, what is the GP going to give me or do for me? And I was actually having this chat with a sports physician last night who is brilliant at one of my workplaces, and we were saying that this is currently the issue with healthcare is that GPs feel like they need to physically do something, and the only things that are available to them are medication or imaging. I shouldn't say that's the only thing that's available to them, but they're the ones that they choose to use. And in reality, a lot of the time, all the patient needs is reassurance and I guess education and pointing to the right area. So if they need more than that, absolutely investigate and absolutely provide medication. But for a lot of injuries that they haven't actually, I guess musculoskeletal injuries, they need to be seen by physio. So I think first thing out there is, if you are physically injured from a musculoskeletal point of view, ideally go see a physio. Okay? The only time where I would preface that and say go see a doctor is if you think you've broken something and genuinely think that you've broken something. The problem is I do have a lot of patients out there who are quite anxious, and that's quite reasonable, but they've gone and done something that has no mechanism of injury for a fracture, but they've got pain, so they think it's broken, so then they go and get a scan. Now, usually if there's a fall, there's contact, there's something hard, then you're more likely to have a fracture. So if you've fallen from a pole onto your arm and it's quite painful, absolutely go get it x-rayed. Not a worry. That's fine. But if you have been poling and you're just doing heaps of chair spins and you start getting shoulder pain, there is no need for you to go get a scan. There is absolutely no need for that. If you are in a lot of pain and you need some stronger medication because the over-the-counter medication isn't appropriate for you or isn't enough, then that's fine. Then you could certainly see a GP, but don't expect that to fix your issue. Yeah, and unfortunately, where the healthcare system is currently letting us down is when GPs don't refer on. A common one I see of this is ankle sprains. Unfortunately, where GPs go, it's just an ankle sprain, you'll be fine, it will fix itself. It won't fix itself. We know that the risk of chronic ankle instability is actually quite high if you don't have appropriate rehab for it. So any musculoskeletal injury, go see a physio. If you're not sure about it, book in and see a physio, and if they think a doctor's appropriate, trust me, they're not going to hold on to you. That's the last thing they want to do, is to be medically liable for anything else that could be going on. They're going to get you into a doctor. Absolutely. Like, I've had patients come in with injuries before and I'm like, no, this is blood clot. Like, you need to go see a doctor, like right now. And I've sent them straight to emergency. Or I've had a patient come in with, knee sepsis, which was just missed by doctors. Like, the amount of times doctors have gone, no, go see a physio, and I've had to send something back. It happens. Like, it's going to happen. We're not all superhuman, and we're not able to pick. Like, I had a beautiful doctor who I know is a brilliant doctor, unfortunately missed shingles on a patient. Patient came in, saw me, picked up like their top, lifted up, and I was like, you have shingles, back you go. so there's stuff like that happens. It's okay. Like, not everyone's going to get it right all 100% of the time, but go see a physiotherapist first, and then if they need additional, then they can call up the doctor, they can get you into the doctor. The only other time I would preface a doctor first is if you have a really good relationship with your doctor. And there are some people out there who know their doctor well. They've been there like their childhood doctor, and you trust them like implicitly, then that's fine. Go see them. They know you. They'll know what to do. But I'd usually otherwise say go see a physio first. Yeah. Obviously biased, but I think for good reason. I genuinely think for good reason. I think there's way too many scans that are being done. There's way too many investigations that are unnecessarily being done because GPs, unfortunately, a lot of them don't actually know how to manage an injury. And there's nothing else they can do other than to send you away. And a lot of the time, patients get cranky when they get sent away without anything. So they're like, well, I better appease the patient. Here's a scan. Yeah.
I would agree. Guys, we've covered off a lot and we still have some listener questions.
Yeah, we might dive into listener questions. I think some of them have actually been answered by our discussions. There are a couple that I think is really interesting. The first one being, is there a point where you have too many niggling injuries where pole is maybe just not a safe sport for you?
Yes. Yes is the answer. But again, it doesn't mean that there's not things that you can't do. There's been 1 or 2 patients that I've seen over the last year that are completely burnt out. And it's not just an injury point of view now, but it's actually a medical issue. And they've had to undergo holistic care. So I kind of talked about this. And if they were to do pole, they would actually cause considerable medical concern. So for them, we've had to go, okay, well, maybe we can do this and this once a week, which may involve some light dancing, some stretching and so forth. So they can still be active. They're encouraged to still be active, but we have had to modify activity. The chance of that happening is low. So these are like the 1% cases that happen. So yes is the answer. There is a point, but quite often there may need to be a period of modification, whatever level of modification the physio needs to see fit, but then a reintegration back to pole. So even if you feel like you're broken, like even if you think that there's multiple areas of your body that are broken, there are still things that will need to be done in a short period of time with modification that can then get you back poling. So do you need to stop ever completely? No. And we can see that beautifully exampled by, patients who have been poling or, pole dancers have been poling for 10 plus years versus, polers who pick it up at the age of 50 or 60 and they're just brilliant. So I think we have quite a range of spectrum of pole dancers now compared to, say, 15 years ago.
And I think, too, it might even be a change in mindset then when returning to be like, I might not ever be that advanced poler. And why did I come to pole in the first place?
Yeah.
Is it still fulfilling me? Or can I find this fulfillment in another sport? And that might be a huge part of it, to be like, I can do it, but I'm not going to be able to achieve the things I originally signed up for. Am I okay with that?
And I feel like that mindset's really important because it changes as you get older. Not that I'm old, but I feel way more mature than what I was 5 years ago when I approached pole, which I kind of hope. But I did write a blog on this earlier in the year that when I wrote it, I didn't realize how personal it was to me. And it was about how taking a break from pole is okay. And I see a lot of patients who come to me desperate, clinging on to the thought of like, I must pole dance. And they're so upset at the thought that they can't pole dance. It's okay if you do need to take a break. There is absolutely nothing wrong with that. And when I wrote it, I actually ended up writing it from a personal experience, which was over the last year, I've actually fractured a rib. And not many people know this. I haven't actually publicly announced this anywhere, really. And I was doing everything I needed to as a physio. And it was kind of similar to yours, Steph, in terms of your rib injury, that it took quite a while to diagnose because there was no mechanism of injury, and it's really unheard of. And for someone to then fracture a rib, we need to figure out why the underlying cause of it is, because there was nothing. Unlike yours, there was no incident. So there's got to be medical tests and so forth. But I had to take time away from pole and modify a whole lot of things. And I look at pole completely differently, even now to maybe 2 years ago, in terms of what it does to fulfill me. And so my relationship with pole has completely changed. I use it because I've always done it because it empowers me, makes me feel strong. But how I try to push myself now is completely different to what it used to be. Yeah. And I think that's important for listeners out there to sort of go, ask yourself, what does pole mean to you? Why do you do pole? And always come back to the reason why you do pole, and why is it so important that you train 6 or 7 times a week when you could potentially be, putting less stress through your body. Like, are you able to achieve the same things in different ways? Yeah.
Yeah. And everything in life comes back to purpose.
Yeah.
Like, why did you start doing, like, what is the reason for this? Am I now still fulfilling this purpose?
Yeah.
And the answer might be no. And I've actually had this conversation recently with somebody, and we're actually thinking of doing a podcast episode on it, is I think with pole, we associate so much of our identity in it. So then it's like, who am I if I'm not a pole dancer anymore? So that's a whole
Oh my gosh,
topic.
that was bad. Well, you hit that nail on the head for me, because over the last, however long, I was like, how can I be a pole physio if I'm not pole dancing? So I ended up having to talk myself through that from an identity crisis point of view, and went, I am still the pole physio. I'm still like, so having to go, just because I'm not pole dancing right now doesn't make me any less of a pole physio. And it was then validated by every patient that I treated, and was able to help them on their pole journey. And a lot of instructors even go through this when they potentially go from being the student themselves to shifting the way that they're like maybe doing less competitions and more about, it's for them, if they get injured, it's all about still trying to get their students doing what they can. So it's really interesting. You see a mind shift quite a lot with instructors where they go, I don't even care if I can't do this trick anymore. I just want to be able to teach so I can teach these people. Yeah, it's fascinating.
I like that's where I'm at, because I'm like, everyone's like, you're going to compete. I'm like, oh, I don't know. Like, I'm not actually, I don't really love competing. I don't love performing. And I had to do like, a little bit of identity stuff for even this year about competing. And I'm just like, I don't really want to do it, but I feel like I kind of have to, like, to almost show, hey, like, guys, like, I can
this
do
is who
this,
I am,
or,
like,
you know,
come train
and
with me.
trying to like encourage, like, not encourage other people, but like lead by example almost, I felt like. But yeah, I went through that, and I was like, you know what, like, I don't love doing that. I love teaching, and I love helping people get to, like, I want to train people to be better than me. Like, I was like, I don't want to be better than everyone. I want to train you guys to be better than me, because I know I have limitations, and I know my limitations. I've spent like years now learning that, and I do what I like to do, and I love it, and I don't feel like I've had a time where I'm really lost my pole mojo or wanted to quit pole, because I've sort of doing the parts of it that I like, and really making sure that I'm happy with what I'm doing.
I think that's so important. Like, absolutely hit the nail on the head there.
Yeah.
Another good one we said, and we've sort of covered this, but how much we've talked about a lot. Did we really go into like injury prevention and how to prevent the most common injuries?
No, we did in terms of like talking about how as studios we can like do that.
Yeah.
But I think this is probably like my favorite thing to talk about. And obviously, like, I can talk. we can gather that from today. It's just a shy look at it.
We can all talk.
I was going to say, we could even do a whole nother podcast on this specifically, because I'm like, here goes another hour.
I was about to say, I won't keep you for too long. I'll keep it simple. Effectively, so if you're talking about injury risk reduction or injury prevention, if you have a squad, every athlete needs to be screened. The reality of an instructor, one, having the skill set to be able to do that, but two, having the time and ability to do that is actually quite low. It's quite hard to do. So that's obviously where physiotherapists, that's our skill set. So we will screen individuals for those risk factors. So for the modifiable and the non-modifiable risk factors, and they will change depending on the different parts of the body. So we do that at AFL at the start of a season. We would basically do 2 or 3 sessions that were full screening specific sessions, and take their players through their paces from a physio and S&C point of view. We would use that to flag any risk of injuries, and then we'd basically tailor individual programs to the athlete's needs to try and reduce the risk of injury based on all the research out there. So I did a full meta-analysis on this in terms of literature. I ended up for Carlton, basically worked with the men's as well as the women's on this in terms of going, okay, well, here are the outliers and here's what we need to fix, and how do we reduce the risk of ACL injury. And it was a whole year of my life working on that. So that was fantastic, and it gave me great experience and knowledge to be able to implement it with pole dancers. But so once you've figured out what the injury risk is, so for example, if we're talking about an Aisha, where you're talking about their bottom arm needs, quite a considerable amount of movement, we can very quickly as pole instructors go, okay, everyone sit against the wall. Can you lift both arms up and touch the wall with your thumbs? Really, really simple, right? Super simple. If they can't, get them in to see someone. It's not your problem to fix, but just go, look, you're lacking shoulder mobility. The next, step that we're trying to work on is an Aisha. If you can't physically get your arm past there, you're not going to be able to Aisha without injuring yourself. It's like, it literally can just be that simple. And I've done so much on this in terms of screening for tricks. So every anatomy series I've done, effectively, I think, I've basically put how do you know when you're ready for this trick at the end of my blog? And I've done a whole bunch of can you stabilize your shoulders correctly? Do you have enough pushing strength? Do you have enough pulling strength? So I think the answer, to bring it back to your sort of question there, Steph, is that studios need to look at screening as a part of their syllabus marking. And this is where I think things need to change and go. So if you are passing someone from beginners to intermediate, and the criteria is to actually, no, let's go intermediate into advanced. Their criteria is they need to be able to do a whole bunch of straddles and repeats on the other side. They need to be able to do this mega combo or this trick. Great. But also they need to be able to do this many of like, this push-up, shoulder blade push-up exercise. They need to be able to have full shoulder mobility. They need to be able to do this many knee tucks. So they almost need to pass a conditioning section too, because then that's what they need to be able to do for their Aisha. So they shouldn't be able to pass intermediate until they can do all these things that tick off the prerequisite for advanced. And that is where I would ultimately love to see pole go, is that when we're looking at syllabus, we're not just looking at, the tricks for each level, but we're looking off the marking criteria, and people should be able to pass or mark off different criteria that are requisites for tricks. And that's where I put all the free information out there. It's like literally it's up to the studios to use it, because it's all out there now. And if you're looking at your big tricks going, okay, this level we're working on the handspring, like it's all there. It's basically like just include it.
Yeah, and I was going to say then that also puts the responsibility in the student's hand to a certain degree. It's like, we're not going to baby you and, we'll have your conditioning in classes, but we're not going to baby you and go, okay, are you doing this? Like, we're going to now test it. It's like, okay, you need to be able to show us at the end of this level or whatever, or to get into the next level, that you can hit these benchmarks and you can do this sort of stuff. So, I agree. I love it. It's like...
Yeah, hard conversations need to be had sometimes with students, because I've seen students before like try to do a straddle, but they can't do a knee tuck. Yeah. I'm like, if you can't do a knee tuck correctly, and a really good job, why do you think you're going to be able to straddle? Like, why are you flinging yourself upside down? You're not controlling your shoulders. You're not stabilizing your upper rib cage. You're increasing your risk of a rib injury by trying to throw yourself up there when you can't even do a basic knee tuck. So I just think things like that just need to be implemented. Does it mean we need to completely ruin the fun out of it? No, not at all. No. Not at all. We can still make it fun. We can still make it, strong and powerful and sexy and all the things that pole is. But it's just about now, using some S&C personal, training, common sense, behind it. Yeah.
Can we just do one more student question
before
we move on? and we'll finish up, and we are definitely getting you back. So, guys, if you're loving this, don't worry, she will be back. She doesn't know that, but we're making sure of it.
I expect to be back many times. I'll be a regular on the show.
Excellent. Yes. We'll take it. So the next one is, and I think this is really good, because there's not a lot. There's a lot of pole physios now. They're starting to come out, but there's not a lot of them. So what's something we should tell a physio about pole if they haven't had previous experience with it?
Oh, that's a good question.
Yeah.
Obviously, it's different from other sports, but it's actually not that different. In the sense of, as a physio, we're taught at uni a certain skill set to analyse movement. So, for example, you give me a video of any sport and I can analyse it. I don't need to know the sport, I can analyse it. And it comes down to basic function, muscles and movements. So, throw me a video of archery, I should be able to put into slow motion and go, okay, to be able to do this, you need to be able to do this, X, Y, Z. So I would probably say, if you're comfortable, show the physio what you're trying to do or how you've injured yourself, or show a video of it. It doesn't have to be you. You can just, go for your hashtags on Instagram, hashtag PD, whatever trick here. Find whatever it is and show them what you're trying to achieve, because until they visually see it, they're not going to be able to break down and analyze that movement in their head, or even have it saved to your, your roll, your videos and your camera, so they can slowly just go back and forth, because physios are very visual people. We're very intelligent people, but we are very visual people. And we're also obviously quite touchy people in terms of we like to do things hands-on, but visual assessment is probably one of the things that set physio apart from other people, in terms of just our skill set to be able to analyse. So 100%, not necessarily something you need to tell your physio, but something you can do to show your physio to help them understand you better as a pole artist or pole dancer, or pole fitness, whatever sort of how you define yourself. I think that's really important. I would probably advise against showing them any promiscuous videos, in terms of, to just be careful in terms of what you're showing, particularly if it's a male-female relationship. They're still technically a medical professional, healthcare doctor. Obviously, if it's me, I don't really care. I'm fine. So just choose your person. But yeah, there's still obviously a professional relationship. You don't want them to get into trouble, but try and show what you can from a professional point of view. I think that's really helpful.
Yeah, and I think I've done that in the past. Like when I found my first really good physio, it was like videos upon videos upon videos. But she left me.
Oh,
She went interstate. She left me. I know. I was just like, I was devastated. But holy shit, this is epic.
Yeah.
Yeah, that was great.
Like, I don't even have words for how amazing this episode is. I'm just trying to figure out, and this is going to be my husband's job, and he's standing over there eating, and it's going to be his job to figure out where the hell we cut this into.
Good luck.
Yeah, good luck. There has been so much good information, and I just can't even, I reckon, guys, if you're listening, you need to listen to this like 2 or 3 times.
Yeah.
It's one of those podcasts that you probably need to, when something's going on, just come back to, because there was a lot of really good information in this. So Simone, where can people find you?
So Instagram is probably the easiest. So the pole, oh my gosh, the pole.physio? It's the pole.physio. Oh my gosh, how embarrassing. I should know this. It's
I was like, physio?
No,
the physio. Like, I thought you forgot the word physio.
I was just trying to remember. Oh God, I was trying to remember where the dot was. No, it's .physio, and I should know that. So it's a pole.physio in terms of Instagram. I now have a new website. It's taken me so long, but I'm so excited, and it's beautiful and pretty and all the things. So go check it out. So that's www.thepolephysio.com. So get the dots right there.
Yeah.
And then obviously Facebook as well, under Pole Physio. So you can find me there as well. In terms of appointments, because I know there'll be a lot of people like asking questions about that after this. So I do accept patients online for appointments. I do have a limited amount available this year. I'm pretty much booked out through to mid-November at the moment. It's blown my mind really. I knew there was definitely scope out there for this, but I know there's a lot more people who have been waiting for longer, so thank you to those for your support, but also your patience. But yes, you can definitely book an appointment with me. It just won't be for a while, and unfortunately I am unable to accept any American patients based on legislation. So if you are American, I'm very sorry, but you can still access all my amazing free resources, and my team, they're incredible, all the resources that are out there via the website. And you can certainly send through questions via Instagram. I won't answer personal injury questions ever, just as a little keynote there. But I'm happy to point you in the right directions for things, that's for sure.
Yeah. Wow, that was amazing. So thank you so much for all your time this morning. We knew we were going to geek out on this, but I don't think I expected what we got. It was above expectations, 110%. So guys, if you're loving Uncovered and you want to see Simone back, which we know you all do, please make sure you come hang out with us on Instagram. Obviously, every week we discuss whatever the topic of our podcast is. So we'll be talking all things everything here. I don't even think there was a really great common theme. There's a lot. So we'll be talking everything pole injuries probably this week. So that's at uncovered.pd. And don't forget, we're on YouTube. So if you want to actually see this live or you want to listen to us in a different space, hit us up and look for Uncovered for pole dancers. So yeah, until next time. Thanks, guys.
Thanks, everyone. Thanks for having me on board.
Yeah. Holy